going to record a video sort of about the coronavirus, but also about the common cold and other just common upper respiratory infections. Right now, what's today? It's March 14th, 2020, so we're in the midst of the coronavirus hysteria. And I think that's an appropriate term, honestly. The virus is in America and it's going to spread, and we are seeing exponential increases in cases right now, the same way China did, the same way Italy did, the same way South Korea did. And it'll peak and then it'll go down. And it'll still continue to be in the population, but nobody will care after this year, most likely. It has probably overall a 1% mortality rate. Mostly elderly, people with respiratory diseases, predominantly. Children, young healthy people seem to be virtually non-existent in terms of the deaths or serious illness, so that's good. I'm a type 1 diabetic, so I'm actually in one of the high-risk groups myself. I should probably be more worried, but I'm not. So people have asked a lot lately, do I have any suggestions about the coronavirus and what to do about it, other than don't listen to the news and stop going on the internet. Just kidding. No, it is important to do social distancing like they're suggesting, and avoid crowds, and shutting down schools and closing large gatherings, and all those things are important just to prevent that huge peak in the spread of the virus right now. That's the best thing people can do. On an individual basis, I would say taking vitamin D is one of the most proven to be one of the most effective things an individual can do to prevent either contracting an upper respiratory virus or having a severe case with one, which includes influenza. When you see the commercials on the radio, hear them on the radio or see them on TV that say the flu vaccine is the best way to prevent the flu, that's actually not true. It's been proven through multiple studies that taking vitamin D is more successful at reducing your chances of having a big problem with the flu than the vaccine is. So that's true for any respiratory virus, honestly. People have all kinds of other things that they do. They may take elderberry or homeopathics or lots of vitamin C or various, colostrum, who knows what else you're going to do. Whatever, it's probably all harmless to take any of that stuff. I wouldn't go eating Tide Pods or drinking bleach. Most likely the people who watch my videos already don't do that stuff, but there are people out there advocating things like that. So the other thing, LDI, what we do here, is something that may or may not work. I have a mixture for LDI that's called URI, which stands for upper respiratory infection. It's a combination of some other mixtures that I had made. I had the flu mixture, which had 20 years of influenza vaccine samples compiled into it, so it's pretty broad. And I had one that I made called cold, which was for the common cold. It has a dozen or so strains of rhinovirus, which is one of the more common types of viruses that cause the common cold. And it has one strain of coronavirus. It is, of course, not COVID-19, because that's a brand new virus that just showed up in 2019. But it has one strain of coronavirus in it. I have no idea if that will immunologically cross-react with COVID-19, if you were to get it, if it will mitigate the illness that you have, or anything. We just don't know. The other group of viruses that are in the URI mixture are Coxsackie viruses. Coxsackie viruses commonly cause, what seem like routine upper respiratory infectious illnesses, maybe with a rash. They cause hand, foot, and mouth disease, for example. That's a pretty common childhood infectious illness. So those are the components of what's in our URI mix. And there is one coronavirus strain. So we've used the URI mix with our family and with other people that we know, and a small group of our LDI patients around the world for a while now, who are prone to repeated upper respiratory illnesses and whatnot. And it does seem to work, I would say, maybe modestly more than half the time, to either completely stop the illness that you have coming on, or to mitigate it, the severity, and help you get over it a lot faster. In our household, it works for my wife more often than it works for me. I don't know why, maybe because I'm a diabetic. And the kids are all hit and miss, whether it works seemingly miraculously or doesn't seem to do anything, or somewhere in between. So this is certainly not something everyone should look at as a must-have on their shelf. But I'm putting it out there because we get the question a lot. When you have first signs or symptoms of an illness, a 5.5C dilution seems to work best. If you've already been sick for a couple of days and it's pretty bad already and your immune system is really ramped up, we found that using a 6C dilution is a better idea. It's a little weaker and isn't likely to, worsen things, which there is that potential, right? With LDI, there's always the potential to worsen things instead of make them better. So when we're already quite ill in the midst of a respiratory infection, we take a 6C dose, and if it's the very first sign, we take a 5.5C. It may or may not be helpful, but that's what I'm putting out there just so people are aware. And otherwise, like I said at the beginning, just, follow your local public health guidelines and avoid crowds and gatherings. And if they close down your schools, you'll have to deal with that. If your workplace closes down, you'll have to deal with that. And then this is almost certainly going to pass. And we'll just pick up the pieces of the economic fallout afterwards. Thanks.